Hi all, welcome back to my channel. I hope you guys are doing good. Today I'm going to discuss about PEWS, that is Pediatric Early Warning Score. Let's move on to the topic. Pediatric Early Warning Score. So the main purpose is to identify the pediatric patient at risk for clinical deterioration. It enables the early recognition of sick patient and management of any deterioration. It's been categorized according to different age groups, that is from 0 to 11 months, 12 to 23 months, 2 to 4 years, 5 to 11 years, and more than 12 years. So in this, we are going to discuss about 0 to 11 months. The main parameters are oxygen saturation, respiratory rate, heart rate, systolic blood pressure, conscious level, body temperature, and capillary refill time. As I explained earlier, it's been categorized based upon different age groups. And I'm going to explain about 0 to 11 months. Moreover, this is not uniform universally. It may vary from hospital to hospital based on its policies and protocols. So just I'm going to explain about the criteria. So here you can see the parameters and the color codes. As you all know, green color, the score is 0, yellow, the score is 1, and for red, the score is 3. So the first parameter is oxygen saturation. So if the oxygen saturation is more than or equal to 94%, you can give a score of 0. If the oxygen saturation is between 92 to 93%, then you can give a score of 1. If the oxygen saturation is less than or equal to 91%, then you can go for a score of 3. The second one is any supplemental oxygen. So if the baby is on room air, you can give a score of 0. If on supplemental oxygen and the rate is less than 4 liters per minute, you can give a score of 1. If the supplemental oxygen rate is more than 4 liters per minute, then you can give a score of 3. The next one is respiratory rate per minute. So along with the respiratory rate, you have to look for signs and symptoms of respiratory distress that we can discuss little later. So if the respiratory rate is between 30 to 49 breaths per minute, you can give a score of 0. If it is between 50 to 69, go for a score of 1. If it is more than or equal to 70, give a score of 3. On the other hand, if it is between 20 to 29, give a score of 1. If it is less than or equal to 19 breaths per minute, then give a score of 3. The next one is heart rate, that is beats per minute. If the heart rate is between 110 to 159 beats per minute, give a score of 0. If it is between 160 to 169 beats per minute, give a score of 1. If it is more than or equal to 170 beats per minute, you can give a score of 3. On the other hand, if it is between 100 to 109 beats per minute, give a score of 1. If the heartbeat is less than or equal to 99, then give a score of 3. Next one is systolic blood pressure. So if it ranges between 70 to 99, give a score of 0. If it is between 100 to 109, give a score of 1. If it is more than or equal to 110, you can give a score of 3. On the other hand, if it is between 60 to 69, give a score of 1. If it is less than or equal to 59, then go for a score of 3. The next one is conscious level. So if the baby is alert, give a score of 0. If baby has response to verbal or painful stimuli or unresponsive, give a score of 3. Next one is body temperature. If the temperature is between 36 to 37.9 degrees Celsius or 96.8 to 100.22 degrees Fahrenheit, give a score of 0. If it is more than or equal to 38 degrees Celsius or more than or equal to 100.4 degrees Fahrenheit, you can give a score of 1. If it is between 35 to 35.9 degrees Celsius or 95 to 96.62 degrees Fahrenheit, give a score of 1. If it is less than or equal to 34.9 degrees Celsius or less than or equal to 94.82 degrees Fahrenheit, then give a score of 3. The last one is CRT, that is capillary refill time. So if it is less than 2 seconds, give a score of 0. If it is between 2 to 4 seconds, give a score of 1. And if it is more than 4 seconds, give a score of 3. As I said before, whenever you are counting the respiratory rate, you should also look for signs and symptoms of respiratory distress. So it is divided into mild, moderate, and severe. If the baby has nasal flaring, subcostal resuction, then it is mild. Under moderate, the baby will be having head bobbing, tracheal tug, intercostal recession, inspiratory or expiratory noises. If it is severe, then the baby will be having sternal recession, grunting, exhaustion, and impending respiratory arrest. So you can clearly see in this picture a baby in respiratory distress. So let's see about PEWS score interpretation. So if the score is 0 to 2, the baby needs 4th hourly vitals monitoring and routine resident review. If the score is between 3 to 4, the baby needs 2nd hourly vitals monitoring and frequent review by resident or PICU fellow. If the score is between 5 to 7 or more than that, the baby needs hourly vitals monitoring. Better to inform the consultant and transfer out the baby to PICU. Thank you so much for watching this video. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Jebin Shine, and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all once again. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.